let's get a closer look at the risk factors. And we have a list of a few, starting with smoking, which, Doctor, you've mentioned. It was one of the few that you've mentioned earlier. Smoking, gender as well. So are more men or women more prone to aneurysms?
So I actually sometimes jokingly tell my patients that if there were no cigarettes and somebody cured diabetes, I would have to find something else to do.
You'd be out of work.
I would be jobless.
You'd be out of work.
I would have to find a different specialty. So, you know, cigarette smoking is a major, you know, factor in this. So the typical profile of the aneurysm patient will be a man. Men are actually almost 10 times are likely.
Men
more
are
likely.
10 times. Wow.
Yeah. Very unusual to see this in women. A male who has smoked for 10 or 15, 20 years, and they're in their 60s and they have high blood pressure. This is the typical, you know, blueprint profile for the patient who will come to us. So age is very important. Age
is very important. And there's also, I saw their genetics. So how much of that is, if it runs in the family, you might be more prone to it?
So patients who have family history, we call it positive family history of aneurysms, they will either know that mom or dad had an aneurysm or even worse, that it ruptured. They're 4 or 5 times more likely to have this problem. So this is a starting point for most patients to say, gee, you know, is this happening to me? And they seek medical attention. There are simple imaging studies that can tell us whether somebody has it or not.